Hello friends, if you are 65 or older, I need you to stop what you are doing and hear this. Because starting this July, there are several real concrete changes hitting seniors that are going to show up in your monthly budget, your health care access, and how far your Social Security check actually goes. And here is the problem. Most seniors have not heard about any of this yet. Not from the evening news, not from their bank, not from Medicare, and in some cases, not even from the agencies making the changes. Today, I am going to break everything down in plain English, tell you exactly what is changing, what it means for your wallet, and most importantly, what you can do right now to protect yourself. Because if you are not paying attention, this combination of changes could quietly cost you hundreds of dollars over the coming months. Let us get into it. The first thing you need to understand is something many retirees have already felt but cannot quite explain. Their monthly expenses keep rising, but their paycheck does not seem to keep up. And July is arriving at a moment when that squeeze is getting tighter. Think about it this way. Earlier this year, your Social Security benefit increased by 2.8%. For the average recipient, that added roughly $56 to your monthly check. At first, that probably felt helpful. Then electricity costs went up. Groceries became more expensive. Gas prices increased. Medical expenses crept higher. Suddenly, that extra money does not feel like extra money anymore. It feels like you are simply trying to keep up. And that is exactly what millions of seniors across this country are reporting right now. But here is what makes July different from the past several months. It is not just one thing changing. It is several things hitting at the same time. And that combination is what creates the real pressure. Let us start with Medicare Part B, because this one is already affecting your check and most people do not realize how much. The standard Part B premium jumped to $202.90 per month this year. That is up nearly $18 from last year. For most of you, that amount is automatically deducted from your Social Security benefit before it ever reaches your bank account. So that 2.8% COLA increase, a third of it or more is already gone before you even see it. And the Part B deductible is now $283 for the year, which means more out-of-pocket costs before coverage even kicks in. But that is just the beginning of the health care squeeze happening this July. If you are enrolled in a Medicare Advantage plan, pay very close attention. Many of these plans are implementing mid-year changes right now, and most people do not find out until they are standing at a pharmacy counter or sitting in a doctor's office. We are talking about formulary changes, which means the list of covered drugs is shifting. Medications you have been taking reliably for years might suddenly move to a higher cost tier, require prior authorization, or need you to try a cheaper drug first before the plan will cover what your doctor actually prescribed. Independent analysts tracking these plans report that popular medications for blood pressure, cholesterol, diabetes, and arthritis are seeing copay jumps of $10 to $40 or more per month for many enrollees. If you are on multiple prescriptions, that alone can add $100 to $200 to your monthly expenses starting this July. That is not a small number for someone living on a fixed income. On top of that, provider networks are tightening in some Advantage plans. Specialists who were covered last year may now require additional paperwork or pre-approvals. Procedures and therapies that used to move quickly are getting slowed down by new automated prior authorization systems. Senior advocacy groups like the Senior Citizens League have raised serious concerns about AI-driven approval processes causing unnecessary delays and denials for treatment seniors need right now. A knee replacement, cataract surgery, physical therapy. These are not luxury services, they are essential care, and the friction in the system is growing. For those on original Medicare with a Medigap supplemental policy, you are not entirely shielded either. Many Medigap carriers are adjusting rates mid-year, and if your policy anniversary falls in the summer months, you may see a premium notice arriving very soon. Now let us talk about prescriptions more specifically, because this is one of the biggest pain points and it deserves its own moment. The Inflation Reduction Act put in place important protections, including insulin price caps, and those remain in effect. But broader drug pricing pressures are real and growing. Generic medications that used to cost next to nothing have seen quiet price increases flowing through from supply chain and manufacturing cost pressures. And when plans redesign their formularies mid-year to manage their own budgets, seniors often bear the cost of those adjustments. The Senior Citizens League has noted that even with existing protections, overall drug costs are outpacing the financial safety net for many retirees. What does this mean practically? If your total monthly income sits around the average Social Security benefit of $1,800 to $2,500, every extra $50 or $100 in drug costs forces real trade-offs. Skipping a dose to stretch a prescription, cutting back on groceries, dipping into emergency savings. These are not hypothetical situations. They are happening right now in homes across this country. Beyond healthcare, everyday costs that hit seniors hardest are climbing hard this summer. Grocery prices, especially for staples like eggs, dairy, and fresh produce, continue rising faster than official inflation numbers suggest. Energy bills, particularly air conditioning during peak summer heat, are spiking in many parts of the country. Housing costs are creating some of the most severe pressure. For renters, many apartment complexes finalize their annual increases around mid-year, and seniors are seeing rent bumps of 4 to 7% or more, depending on location. That can translate into an extra $60 to $150 a month on a fixed income budget. For homeowners, property tax assessments or escrow adjustments frequently hit in July. And while many states have senior property tax relief programs, missing the application deadline, which often falls in July or August, means paying the full rate for the rest of the year. One analysis from senior advocacy groups found that many retirees are now spending 35 to 40% of their monthly income on housing and utilities alone, well above the recommended 30% threshold. Here's the part that does not make headlines but matters enormously. Nearly 44% of retirees now rely on Social Security for 100% of their income, not as a supplement, as their entire financial foundation. When healthcare takes a larger bite, when groceries cost more, when rent goes up and utility bills spike in the same month, it forces choices that no one should have to make. Skipping medications, skipping meals, delaying home repairs that could become safety hazards. These are the quiet, real consequences of everything we are discussing today. Now let us look at supplemental security income and other support programs, because there are July changes here too. Starting July 1st, there are annual adjustments to income and resource limits for SSI eligibility. The federal benefit rate gets a modest cost of living adjustment, but that adjustment is modest compared to actual inflation in housing and food. For seniors on the edge of SSI eligibility, even small increases in outside income, including part-time work or financial help from family, could push you over the limit and reduce or eliminate your monthly SSI payment. July is also when many SSI redeterminations happen, meaning the Social Security Administration reviews your eligibility. Accurate reporting of your income and assets during this period is critical, because errors or unreported changes can create overpayments that you will have to pay back later. There is also a bigger picture issue quietly shaping everything we have discussed. The most recent Social Security Trustees report moved the trust fund depletion projection closer to late 2032. Now let me be very clear about what that means and what it does not mean. Nothing is disappearing from your benefits this July. Your check is not being cut tomorrow. But that long-term funding pressure is already creating friction you can feel today. More emphasis on cost containment inside Medicare. More scrutiny on claims and appeals. Tighter networks, slower approvals. The system is not collapsing, but the margin is getting thinner. And that matters to real people trying to access real care. This July situation is not a single catastrophe arriving overnight. It is multiple pressures converging at the same time on people who often have the least flexibility to absorb them. And that is precisely why being informed and taking action now is so important. So here's exactly what you should do, starting this week. First, review your Medicare plan documents immediately. Log into your Medicare.gov account or call 1-800-MEDICARE and look for any notices about mid-year changes to your specific plan. If you are in Medicare Advantage, check whether your doctors are still in-network and whether your current medications are still covered at the same tier. Do not wait until a problem appears at the pharmacy or a doctor's office. Second, make a complete list of every prescription you take and call your Part D plan administrator to ask about mid-year formulary changes. If any of your medications have moved to a higher tier, talk to your doctor immediately about alternatives that may still be covered at a lower cost. You have options, but you need to start that conversation before a surprise hits your wallet. Third, talk to your doctors about any treatments or procedures you may need in the coming months. Ask specifically whether prior authorization will be required. If so, get that paperwork started now. Delays caused by authorization processes can stretch for weeks, and starting early is the best protection you have. Fourth, sit down this week and map out your summer budget. Write down exactly what comes out of your Social Security check before it reaches your bank account, including your Part B premium and any other deductions. Then list your expected expenses through October. Factor in higher utility costs, any rent or property tax changes, and your updated prescription costs. If the gap is widening, look into assistance programs now, not later. LIHEAP provides energy bill assistance and has summer funding rounds. Area agencies on aging can connect you with food programs, transportation help, and other senior resources in your local community. Many seniors do not use these programs because they do not know they qualify. Fifth, if you receive SSI or other needs-based benefits, gather your financial records this week and confirm your current eligibility status with the Social Security Administration. Make sure all income and asset reporting is accurate and up to date. Small reporting errors can create overpayment situations that become a serious burden later. Sixth, if you own your home, check your county assessor's website this week for senior property tax relief programs. Many of these programs have deadlines in July or August. Missing the deadline means you lose the relief for the entire year. One phone call or website visit could save you hundreds of dollars. Finally, stay alert to scams. Every time economic uncertainty rises, fraud targeting seniors rises with it. Phone calls claiming your Medicare is being suspended, emails saying there is a problem with your benefits, texts demanding immediate action on your Social Security account. None of these are legitimate. Government agencies do not call and demand immediate payment or personal information over the phone. If something feels urgent and alarming, slow down. Verify independently before doing anything. Here is the honest summary of where things stand. Your Social Security check is still coming. Your Medicare coverage is still in place. The system is not collapsing. But the financial margin for millions of seniors is getting thinner, and the combination of higher healthcare costs, rising everyday expenses, modest benefit adjustments, and long-term funding pressures means this summer will feel harder than last summer for many people living on fixed incomes. The seniors who come through this period in the best shape will be the ones who understood what was happening and acted before the problems became crises. You are not powerless here. Information is protection. Take the steps we outlined today. Review your plans, check your prescriptions, build your summer budget, apply for every assistance program you qualify for. Talk to your doctors early, and keep paying attention, because these changes move fast, and staying informed is the single most valuable thing you can do for your financial health and your peace of mind. Share this with anyone you know who depends on Social Security or Medicare. They need to hear it. And stay with us, because we will keep tracking every development and bringing it to you straight.